Yeah, so LIMBER 103 is a study that we have open right now at Emory, sponsored by Incyte. So this is with a compound called the BET inhibitor. So this is sort of a very promising pathway, we'll say, in myelofibrosis right now, with another BET inhibitor sort of being in more advanced development, showing really promising activity so far, and that we're seeing with sort of in preclinical studies that inhibiting this the BET inhibitor proteins sort of in combination with the JAK inhibitor seems to be a very effective and synergistic sort of way to treat these patients and sort of improve on outcomes. And so, so far we're seeing, good data so far in the study. This is a study where we are allowing patients to be treated as a single agent, sort of if they've already failed ruxolitinib, are adding it on in sort of the suboptimal response setting as well to patients who have sort of lost or not responded optimally to ruxolitinib. And then we are opening up a frontline arm as well now for sort of frontline combination therapy as well. So sort of multiple different lines that we're using the agent in this study, actually adding an arm in essential thrombocytosis as well for sort of more refractory patients there. And so sort of multiple different populations we're treating in that study now, but definitely very promising agent. I think that, again, the BET sort of family of proteins and inhibition of these epigenetic proteins seems to be a very promising sort of pathway in the disease. Seems to improve spleen and symptom responses beyond JAK inhibitor alone, and actually can see some anemia benefit as well with the potential improved hemoglobin, which can be a big factor, especially in the later line settings where patients do tend to have a lot more cytopenias.